Magandang araw po sa kanilang lahat. Welcome aboard to my YouTube channel. Kapapasok lang po na balita. Galing po ito malamang sa DOH at IATF. Bahala na kayo kung kayo ay maniniwala pa sa ginagawa nila. Hanggat may humaharang sa kanilang kagustuhan, gagawa sila ng paraan para takutin ang tao at mabakunahan lahat. Panuurin po natin si spokesperson ROQUE.
Mga bakuna. As of July 17, 2021, tulad ng inireport ng ating vaccine czar at NTF Chief Implementer Secretary Carlito Galvez, nasa 27,922,360 doses na po ang dumating na bakuna sa Pilipinas. Makikita sa infographics at iba't ibang mga vaccine na nadeliver na po. At madaragdagan pa po ang bilang ng mga ito dahil inaasahan mamayang gabi ay darating ang mahigit kalahating milyon or 562,770 doses ng Pfizer na ating binili. Bukas naman ng umaga, July 22, inaasahan natin ang pagdating ng 1.5 milyon doses ng Sinovac. At sa Biyernes, karagdagang 1 milyong Sinovac ang expected na darating dito. As of July 2021, may higit 5 milyon or 5,031,301 ang nakatanggap na po ng 2 doses na bakuna. Nasa braso na rin po ang mahigit 15,616,562 ang best shot ng vaccine. Ito ang total doses na na-administer na po natin. Pero na po ang pagpapakuna, magpapatulog na po tayo kung saan schedule tayo magpapakuna. Ang bayan po ang first dose at second dose, kaya siguraduhin kumpletuhin ang 2 doses. Magpalista na po tayo, no? Nakipag-ugnayan sa inyong LGU tungkol sa proseso ng pagpapalista. Dagdag na proteksyon ito sa inyo, sa inyong pamilya at sa komunidad. Sa mga nagtatanong sa efficacy ng Sinovac, naglabas po ng analysis ang isang eksperto, si Dr. Reverend Father Kikanor Austriaco, Professor of Biological Science ng University of San Tomas. Ayon kay Dr. Austriaco, lumabas ngayon ang results ng phase 3 clinical trial ng Sinovac sa bansang Turkey. Ito ang first peer-reviewed dataset ng Sinovac na lumabas sa International Science Journal ng Lancet. Ayon sa pag-aaral sa Turkey, mayroong 83.5% efficacy ng Sinovac sa 10,000 volunteers age 18 to 59 na sumali sa clinical trial. Isinagawa ang nasabing clinical trial noong panahon na may alpha variant sa Turkey. Dagdag ni Dr. Austriaco, sa clinical trial ng Sinovac sa Indonesia ay lumabas na 94% epektibo laban sa infection at 96% epektibo para hindi maospital. Sa report na 350 healthcare workers sa Central Java, Indonesia ang nag-infect ng Delta variant, bagamat fully vaccinated, ang hindi ata naha-highlight ay meron ng 5,000 healthcare workers na nabanggit sa lugar na yon. Ano pong ibig sabihin nito? Nasa 4,650 ang hindi nagkaroon ng COVID-19. Katumbas po ito ng 93% protection rate. Ganito rin po ang kaso sa bansang Thailand. Sabi ni Dr. Austriaco, nasa 677,348 medical personnel ang nabakunahan ng 2 doses ng Sinovac ayon sa datos ng Thai Ministry of Health. Sa bilang na ito, nasa 618 ang nagpositibo sa coronavirus at sa 618,597 ay walang sintomas o mild symptoms. Ibig sabihin, 99% ang level ng proteksyon sa Thailand. Kaya wag magpadala po sa mga naninira, magpabakuna po para protektado. Speaking of Delta variant, ano po ba ang dapat malaman natin tungkol dito? Una, mas nakakahawa ba ang Delta variant? Ang sagot, opo. 40 to 60% na mas nakakahawa ito kumpara sa Alpha variant. Pangalawa, epektibo po ang ating mga bakuna laban sa Delta variant. Ang sagot, opo. Ang mahalaga ay makumpleto ang 2 doses. Halimbawa, ayon sa Public Health England, ang 2 doses ng AstraZeneca ay 92% na epektibo para hindi maospital dahil sa coronavirus. Pinapakita rin ng isang pag-aaral na walang namatay sa Delta variant pagkatapos makatanggap ng 2 doses ng bakuna. Pangatlo, may pagbabago ba sa ating pinapatupad na intervention dahil nga po sa Delta variant? Well, mananatiling parehas ang ating mga estratehiya. Ngunit, mas papaintingin pa po natin ang pagpapatupad ng minimum public health protocols. Kasama na rito po ang ating minimum public health standards, order, control measures, at quarantine testing and contact tracing protocols. Sa madaling salita, intensified PDITR or Prevent, Detect, Isolate, Treat, Reintegrate ang gagawin natin. Dapat din nating siguraduhin ang sapat ang ating health systems capacity. COVID-19 updates naman po tayo, no? Ito ang ranking sa Pilipinas sa mundo. Ayon po ito sa Johns Hopkins, no? Number 23 ang Pilipinas pagdating sa total cases. Number 33, bumaba po tayo, no, pagdating sa active cases. Number 132 po tayo sa cases per 100,000 population at number 87 sa case fatality rate. Tignan naman po natin ang bansa ng Southeast Asia at ang kanilang mga aktibong kaso. Ito po ay ayon sa World Meter COVID-19 data as of 21 July 2021. Una po ang Indonesia na mayroong 550,192 na mga aktibong kaso. Pangalawa ang Malaysia na mayroong 133,703 na aktibong kaso. Pangatlo po ang Thailand na mayroong 126,765 na mga aktibong kaso. Pang-apat ang Myanmar na mayroong 67,832 na mga aktibong kaso. Pang-lima po ang Vietnam, 51,043 na mga aktibong kaso. Pang-anim po ang Pilipinas at meron po tayo ngayong 46,806 na mga aktibong kaso. Samantala, sa mga bagong kasong dito sa atin, ito ay nasa 4,516. Bumaba po ito, no? Ayon sa July 2021 datos ng DOH. Nananatiling mataas pa rin po ang ating recovery rate na nasa 95.1%. Nasa 1,444,253 po ang bilang ng mga gumaling. Samantalong malungkot po naming binabalita na nasa 26,844 ang binawian ng buhay. Nakikiramay po kami sa lahat ng mga naulila. 1.77% po ang ating case fatality rate. Ito naman po ang kalagayan ng ating mga ospital sa buong Pilipinas. 54% lang po ang nagagamit nating ICU beds, 46% ang utilized na isolation beds, 43% utilized ang ating ward beds, at 36 utilized po ang mga ventilators. Dito naman po sa atin sa NCR, 42% po ang utilized ng ating ICU beds, 38% utilized ang ating isolation beds, 34% utilized ang ating ward beds, at 34% utilized ang ating ventilators. Sa ibang mga bagay, sa tanong na may immunity po ba ang Vice Presidente sa mga lawsuit, hindi po bagong issue nito, no? Kung inyong matatandaan na tanong din ito sa panahon ni VP Jojo Binay. Malinaw po ang personal kong paninindigan dito. Ang presidential immunity from suit po ay sang-ayon sa jurisprudence. Bagamat wala pa pong jurisprudence pagdating sa Vice President, siguro po magkakaroon ng pagkakataon na magkaroon ng linaw itong isyong ito kung dadalhin sa Korte Suprema. Pero magugulat po kayo na ang nagsabi na mayroong immunity ang Vice President ay walang iba kung hindi ang number one kritiko ng ating Presidente, si dating Justice Secretary Laila de Lima. Lumabas po ito sa pahayagang Rappler noong July 7, 2015. Ang sabi po niya, the Constitution states that impeachable officials shall not be removed from office except by impeachment. It does not say categorically to what extent they may be subject to prosecution without their impeachability being affected. Theoretically, they can be subject to criminal proceedings as long as they are not removed from office, such as what the Supreme Court has done with the commissioners of the COMELEC in several cases when it cited said commissioners in criminal contempt. So ang paninindigan po ni Laila de Lima, binago pa nga niya ang position po niya, ay meron daw immunity ang Vice President. Ganun din po ang opinion ng election lawyer na si Romulo Macalintal na kung maalala ninyo ay tumakbo bilang sa partido ng Delawa, no? At lumabas po ito sa kanyang Philippine Star noong October 15, 2014. Ang sabi po niya, yung dating Vice President Binay, just like the President and all constitutional officials, is covered by immunity from suit, meaning he cannot be charged in court under the normal procedure of trial. Kaya inuulit ko po ang aking unang nasabi, let this be an opportunity to provoke jurisprudence. Dito po natatapos ang ating presentasyon. Makakasama po natin ngayon, unang-una si Cagayan de Oro Mayor Oscar Moreno at Infectious Disease Specialist Dr. Ron Jean Sulante. Puntahan po muna natin si Mayor Oscar Moreno. Mayor, naka-ECQ po ngayon ang inyong syudad. Hindi po ako nakasama nung dumating po dyan ang NTF dahil kinailangan ko pong mag-press briefing sa Davao, no? Pero Mayor, ano na po ang latest sa Cagayan de Oro? Ano pong mahakbang na ginagawa natin, lalong-lalo na po para palakasin ang ating healthcare capacity dyan sa syudad ng Cagayan de Oro? The floor is yours, Mayor Oscar Moreno.
Yeah, Secretary Hari, maraming salamat. And sayang wala ka, we missed you.
Opo.
The team was here, led by Secretary Duque, Secretary Anyo, Secretary Lorenzana, of course, and Secretary Galvez. And together with their respective regional directors, ating DOH, DILG, and pati yung mga sa hospitals natin, nagkaroon tayo ng pagpulong-pulong, and may dala din sila na mga almost 400,000 doses na bakuna. And ang sitwasyon ng Cagayan de Oro is this. Nung May, nag-umpisa ang itong latest surge. And the highest was in June. And mabuti naman na by July, stabilize na, no? Slow down. And in fact, last week we were looking at the possibility na nagplateau na ang ano, no, yung cases. We had gone past the peak, no? And then came out the news about the statement ng DOH na merong detected na 5 na Delta variant cases sa Cagayan de Oro, no? In fact, tamang-tama ko yun, Secretary, na people were expecting na may bagong announcement na naman sa quarantine level. Now, effective June 1, nasa MCQ kami. And so, I was asked, mga June 14, makiusap ba tayo na ma-reduce to GCQ at least GCQ ang quarantine level? Or kung MECQ pa rin, makiusap ba ako given na bumaba naman ang cases and yung ating healthcare utilization rate nasa level na ng 60s, no? Yung below 70 kasi GCQ level na, no? Ang sagot ko po was hindi ako makiusap dahil kung ano ang dapat na quarantine level, sundin natin. After all, kailangan din na ma-sustain natin. Meron na tayong mga small victories since the surge, pero kailangan ma-sustain natin, no? So, ganun, no? And then came out the story nung July 15, July 16. Immediately nakipag-meet tayo ng DOH Regional Office at saka yung ating COVID Referral Hospital dito sa Region 10, which is based in Cagayan de Oro, yung Northern Mindanao Medical Center. And na-report nga yung 5. And so immediately strategies were agreed. Number 1, yung reported na Delta variant, although they were tagged as recovered, even according to the DOH, no, we would gather them back and ilagay sa special facility. And then contact tracing would have to be instituted again, intensified, and hanggat maaari kung pwede umabot ng 3rd degree, no? So the contact tracing was initiated and yung mga primary contacts were brought to an isolation facility. Now, and then tests were made doon sa affected ng Delta variant. And 5 sila, Secretary, just to be clear about it. Yung primary, yung index case is not a resident of Cagayan de Oro. Residente siya ng Manolo Fortich, no? Pero right beside Cagayan de Oro, for all intents and purposes, that's part of Metropolitan Cagayan de Oro, no? And pero ang problema, yung nahawaan niya, yung 4, yung wife niya, 37-year-old, yung anak, 14-year-old, yung mother-in-law, 62-year-old, and yung kapatid ng mother-in-law na 61, no? Are all residents of Cagayan de Oro. Dahil yung wife is a worker sa isang health facility, no? So, they were, again, like I said, gathered and put in a temporary treatment and monitoring facility and tested, no? And according to the test result nung Saturday, isa negative na. Yung 4, andyan pa rin. Yung 3 rather, dahil yung isa is nasa Manolo Fortich, wala sa Cagayan de Oro, no? Although I've asked our health team to coordinate with the health team of Manolo and Bukidnon. Yung 3, positive pa rin pero mataas ng CT value, no? Pero nonetheless, normally ano na yan yung kino-cover na yan ng certified recovered, no? Pero anyway, nandyan pa rin sa ating facility, and I think ang decision is they'll be kept in the facility until their RT-PCR result would show negative. Ang kagandahan nito, Secretary, yung 4 na yon who are residents of Cagayan de Oro, dahil nung lumabas ang result dun sa index case, the automatic mag-contact trace, and then doon sa contact trace, na-identify yung mga close contacts, no? Yung high risk, yung 4. And so they were extracted, this was in June, no? Extracted and placed in an isolation facility for testing. And then 2 days after, 3 days after, they were tested and they tested positive ng COVID. So nailagay sila kaagad, nailipat doon sa temporary treatment and monitoring facility. Now I say this, Secretary, dahil ang maganda nito na kahit hindi pa sila hindi pa sila na test, they were already isolated, no? So the chances of infection, transmission had been virtually boxed out, no? So magandang ano, although again, people are asking me bakit ECQ, sabi ko okay lang yan dahil first reason is kailangan preemptive ang ating approach sa pandemic, no, sa virus. Pangalawa, and this was what I explained to them, yung tinatawag na abundance of caution, no? Kailangan maniniguro tayo na wala nang naiwan dyan na Delta variant dahil ang balita nga is this is more transmissible and probably even deadlier, no? So but in the meantime, we are observing the ECQ and ano tayo doon sa mga spreader events. These are being closely watched kung meron man, no? Para mahinto, Secretary. So, sa awa ng Diyos, okay naman. Salamat din po sa bakuna. Kahapon nagbakuna kami. Again, kahit holiday, we were able to vaccinate mga 3,750 thereabout, no? And then ngayon, tuloy na naman, no? We have already reached, ang maganda dito dahil ang ating mga vaccination sites, we call them the mega vaccination sites, yung SM downtown at saka SM uptown, no? And then yung Centrio, yung sa Ayala, and yung sa Limketkay, no? Papasalamat nga ako sa kanila dahil kahit na ECQ, yung mga malls are sarado except the groceries, no? Pero they agreed to open up their malls para sa vaccination, Secretary. Kahapon, kagabi, umabot ng mga past 7 ang pagbakuna dito sa SM Uptown.
Okay, maraming salamat Mayor Oscar Moreno. Please join us for our open forum later. Kasama rin po natin si Dr. Rosjean Solante. Sir, alam nating mas nakakahawa na itong Delta variant, pero totoo ba hong mas nakakamatay? At paano po dapat paghandaan ng ating mga kababayan itong Delta variant? The floor is yours, Dr. Solante.
Yeah. Thank you, Secretary Roque. I just have to present my slides. Okay, so I think the information has already been laid out by our secretary that Delta variant is really highly transmissible. And I would just like to again illustrate here what is the difference with this Delta variant from the other variants of concern. So this is the virus, and this is the spike protein in the red illustration here. And the white ones are the specific mutations of the Delta virus, Delta variant, that makes it highly accessible to attach to the ACE2 receptor. So this blue one, ito yung ACE2 receptor na nakikita natin sa upper airway natin, no? Kung malanghap natin itong virus na to, then ito yung unang sumasalubong sa atin. Then it is also abundant not only in the upper but also in the lower respiratory tract. Okay, so these are specific mutations na talagang what makes this Delta variant highly advantageous over the other variants of concern. Okay, so just to illustrate to you the difference between the other variants of concern, this is the alpha, and these are the mutations. All of these mutations are located in the spike protein that makes it highly transmissible, attaches itself to the cells, but with the Delta variant, okay, being a highly transmissible infection, these are the reason why it is also highly transmissible. Number one, the viral load. So meaning once it attaches itself to sa ACE2 receptor ng tao, ng katawan natin, no, it produces more virus compared to the other variants of concern. In fact, the estimate here is that the viral load in the Delta variant were 1,260 times higher than the other strains. Okay, during the time that they were able to detect this, no? So this viral load was measured based on a CT value. So meaning the lower the CT value, the higher is the amount of the virus in the cells that it attaches. No? So it can be as low as 12 to as high as 35. Okay, so this is the reason why that with one interaction, a single individual can infect as high as 8 to as low as 4. Okay, and this has been illustrated in this particular data, why it is more transmissible compared to the alpha variant, compared to the beta variant, the gamma. Okay, so overall, it is 97% highly transmissible. Now, being highly transmissible, and because of the overwhelming viral load in the body of the infected individual, it will also be automatic that the reproduction number will also be increased. So mas marami kang tao na pwedeng mahawaan. And 55 to 60% more compared to the alpha and the beta variant. Okay, and that's why the projection here is that if this is how the curve in terms of a reproduction number with the alpha or UK variant is 2.7, then this is how high your Delta variant. Okay, and this has been documented in Australia, where one was infected by the Delta variant just by walking past an infected person in 5 to 10 second encounter. Now, because of this high transmissibility and high reproduction number, it has also been the advantage of this Delta variant over the Alpha variant based on this Public Health England data that the secondary attack rate will also be higher. And in this particular data, you'll notice that more households were infected compared to non-household. But again, the trend is that you have a higher household and non-household transmission as a secondary contact with the Delta variant compared with the Alpha variant. Now, I would like to emphasize again in this particular slide. Now, so these are the vaccines that are currently available in the Philippines as granted by EUA by our FDA. And if you take notice of all these vaccines, I would say these vaccines are still effective in any variants of concern. It's just a matter that some of these vaccines have very good data to show that they're very stable against the Delta variant, like your Pfizer, Astra, and Moderna. Okay? And that also includes the J&J vaccine. But likewise, even with your CoronaVac, since it's also active against the Alpha, then it is also surmised that with the same mechanism and Alpha spike protein antibody production, then this can also withstand the Delta variant. Efficacy may be a bit lower, but again, still highly significant protection with your CoronaVac. Same as that also with your Sputnik, and then even with Covaxin, which has the same platform as that with your Sinovac, and then your Sinopharm, which are still effective against most of these variants of concern. So the message here is that all the vaccines that will be offered to you, you have to get it in order to protect us against any of these variants of concern. So this is my takeaway, how to get over this Delta variant. We continue to proceed with our vaccination rollout because all vaccines at this moment are still working and will work, especially against these variants of concern. And I think Sec. Roque has mentioned the other elimination strategy that the Philippines has been undertaking, like the border control, the test, trace, isolate programs. We continue to avoid what we call super spreader events in the forms of gatherings, parties, etc., and follow the minimum health safety protocol, and particularly improve ventilation among those areas with that are.
Maraming salamat po sa panunood. Huwag kalimutan mag-subscribe at mag-comment down below kung kayo ay naniniwala pa sa mga announcement ng DOH at IATF. Paki-click na din ang notification bell para maging updated kayo sa mga susunod pong video hindi lang dito sa Pilipinas kundi sa buong mundo. See you on my next video.